Menopause, replacing myths with medical truth. Distinguished colleagues, menopause is not a sudden biological shutdown. It is the final point of a gradual reproductive transition called perimenopause. Menopause is confirmed only after 12 consecutive months without menstruation, provided no other medical cause is present. Until that point, ovulation may still occur unpredictably, so pregnancy remains possible. A second misconception is that menopause marks the end of a woman's fulfilling life. In reality, it is a new physiological stage that may bring hot flushes, sleep disruption, mood changes, vaginal dryness, and altered bone or cardiovascular health. But these concerns can often be managed effectively. Hormone therapy should neither be feared nor prescribed casually. It remains one of the most effective treatments for troublesome menopausal symptoms, yet its suitability depends on age, symptom severity, medical history, and individual risks. Decisions should therefore be personalized and reviewed regularly. Weight gain is also not inevitable. Aging, reduced muscle mass, sleep disturbance, diet, and declining activity often contribute more than menopause alone. Resistance exercise, aerobic movement, adequate protein, calcium-rich nutrition, healthy sleep, and avoidance of smoking can protect long-term health. The scientific message is simple. Menopause is not an ending, but a manageable transition requiring accurate information, individualized care, and social understanding. The scientific message is simple. Menopause is not an ending, but a manageable transition supported by accurate information, individualized health care, and social understanding. Let us replace fear with knowledge and myths with medical truth. If you found this discussion valuable, please like, share, follow, and subscribe so that more people can receive reliable, evidence-based health information.